So my name is Marina Fernando. I'm one of the obstetrics and gynecology consultants in London, and I'm also the patient safety lead for London. Well, I have always been very good at academic profile since young age, and I've always been described as a people person. And it was very important when I was growing up. I felt that doctors is better off being improving in their communication and being more approachable. And I felt I could be one of them in the future. My specialty is very unique. It gives me the opportunity in a week to deliver babies, to see elderly women and help with their menstrual problems. So the variety in the specialty gives me great scope and gives me the opportunity to meet different interesting people. It also gives me a variety of skill sets such as scanning and also operating via keyhole surgery or minimal access. And then finally, it gives me an opportunity to work with very different people within the specialty. So some days I work with gynecology nurses, some days I work closely with midwives, and other days I closely work with patients to improve services. So I'm from originally Sri Lanka, a beautiful tropical island. It's the Pearl of the Indian Ocean, a well-known destination. I came to England when I was 16, and I've always grown up in East London and Essex. I think my most rewarding part of the job is actually helping women to go through the journey of a pregnancy, because it can be quite anxious, nervous period, and particularly during the delivery times, supporting the couple and the family and helping a young woman to be a mother. I think a lot of patients value my approachability and my personality of warmness. I've always treated my patients the way I'd like to be treated, or if it was one of my family members, I'd like to be treated. So being approachable, kind, and explaining the situation or offering the care at their pace so that they have control is very important for me. I think the challenges is the acuity of the specialty, particularly in obstetrics. It's very important that we continuously are involved in the care of the women, and when there are emergencies, that we approach it very calmly through effective communication and teamwork, and through leadership. In gynecology, it's very important to explain to patients in a timely manner, and this can be challenging because every patient's need is variable. So in this case, my duty is to identify the patient's need and concerns and address it properly. I suppose I always say that whenever I come across a patient or any patients or family that one must treat others exactly the way you want to be treated. So that's my mantra and that's my work ethic.